Alright guys, alright, here's my first video, and I'm going to tell you about trigger points because that's what I do, and that's what everybody's problem is. It's those tender spots that tend to refer out pain, and not a lot of people know about that referral pain that happens. And I'm just going to give you one example, and that number one example is tension headaches. This is the first video we're going to talk about tension headaches. So there's like many muscles that go across into the neck, into the base of the head. And there's even the facial muscles that also cause tension headaches too that people don't know about. But I'm going to give you some common referral pains that people talk about, and let me just talk about one common one. And that's the one that comes in where you get that tension headache that comes across in the back of the ear and right into the temple. And that one actually comes from a trigger point that happens right in here in the shoulders. Bless you. So, we're live here. So this muscle here, this upper trap muscle here, actually causes a lot of tension headaches that go into the temple. Actually, the one right down here stops right in this midpoint at this point where there's referral pain. So what I do is I treat the trigger points. When somebody tells me that they have a tension headache, I ask them, where is the tension headache? Because every muscle has a different tension headache pattern, like different referral pattern. So for this first one, with the upper traps, it gets that pain, that referral pain in the temple, I'd be treating an area somewhere around here. And you could actually treat this yourself or get a friend to do it for you. So you grab this area here, you pinch in, and when you start getting that recreated pain right there that gets into the temple, hang on to that. Don't let it go. Don't worry about it. That pain's going to go away. That second that pain goes away in that headache and it goes away in that shoulder, that pain and that headache is gone, at least for now, until you recreate that problem again. The next most common one is a pain that goes across the head, around here to the eye. That one would be caused from the suboccipital. That's like right here at the base of the skull. There's so many little tiny muscles in here that hold your head up straight. And it works really hard to keep your head up straight. So of course it's going to be really active with trigger points. So what you can do to treat it is you find that tender spot right in here, and you'll feel it. It feels tender. And what you can do is that you do this yourself, or you can get somebody else to do it, and you push in and just lean back. And you'll know as soon as you feel that tender spot, you know that you've hit a trigger point, because it's going to recreate that headache. If it doesn't, you just wait until that tender spot goes away. It could take anywhere from like a minute or two. And you just hold that, and you wait until the pain goes away. And then you relax back into it again. The other one that's very common is, if you can turn your head, Dora, is the muscle that goes across here. Let's get into technical anatomy terms. The sternocleidomastoid goes across here. This one gets strained a lot, especially when people are holding their phones up to their heads and they're like leaning across the side. Or another thing with these computer techie people, they're like looking up all the time. Well, this here, the trigger point actually causes like a muffledness or hearing loss or pressure in the ear. So if you're thinking that you may, it's mistaken for actually having an ear infection sometimes. And it could be very well from a trigger point that's happening in the SCM. So my point is, let's direct it back here. My point is when you're going through tension headaches and you don't have any kind of definite answer from a doctor or anything like that what's going on, and you want to reach for that pill, which I hate promoting that, because there are different ways of getting rid of that headaches without taking that pill. It's just go see your massage therapist, or just come see me, because this is something that I do. I just want you guys to know, and this is what I'm passionate about, I want you guys to know that there are other ways of getting rid of tension headaches, and that is just number one. This is just the first video that I'm about to do, because there's many more to come that I'm about to educate you with. So this is my tip for today. If you have any questions, private message me, share the video. Peace out.